Opposition leader James Nomane confronted Health Minister Elias Kapavore in Parliament. How can a health crisis persist despite what he calls record government spending? Kapavore disputes the record budget claim, pointing to funding gaps on the ground. Meanwhile, local and international media has reported mothers giving birth on labor ward floors and patients treated on hospital floors across PNG's major hospitals. Don't forget to like and subscribe.
Thank you, Deputy Speaker. My question this morning goes to the Minister for Health. Question without notice to the Minister for Health. Deputy Speaker, over the weekend we saw yet again the international media absolutely excoriate the government and the health sector, confirming that there is a health crisis in the country, Mr. Speaker. Now, we've heard the good Minister for Health provide some vapid responses on what he is doing as the Minister for Health, responsible for all health matters. But, Deputy Speaker, I rise today on behalf of all the mothers that have had to go through labour and maternity services on the floor of hospitals, and this has already been brought to public attention. It was brought to public attention in 2025 and yet again in 2026. Now, my question, Mr. Speaker, 3.2 billion from a historic budget was allocated to health, 3.2 billion kina. In 2026, and to date, we have heard the good minister just simply say that the money hasn't reached the hospitals. The money has been squandered by the bureaucrats. This health crisis that's currently affecting the nation, Mr. Deputy Speaker, it's not by mistake, it's not by fate, it's not by happenstance. It's either because of corruption or incompetence, or both. Now the good minister has to tell the country what steps he has taken to ensure that no more mothers give birth on the floors of these hospitals, and funding directly is provided to all health facilities throughout the country, because it's a complete indictment on the government, Mr. Deputy Speaker. We don't want waffle. We want a clear answer and a solution by this minister on how he is going to absolutely address this health crisis. It's all over the news. It's all over the international media. So he has to tell the people of Papua New Guinea and this Honourable House what he's doing as the person responsible for health matters. Thank you, Deputy Speaker.
The Honourable Minister for Health.
Thank you, Deputy Speaker. I thank the opposition leader for this very important question. And to put on record, I'd like to thank the media, the international media who goes to our hospitals and present the current status of hospitals. I want to thank them for exposing the current status of health in the country so that we can improve what we need to do as a government. We will not blame anyone, but I want to say that we are addressing some of these issues. I'm in the health ministry for 20 months now, 20 months after being appointed by the Prime Minister. And the reason why we're seeing these kind of issues happening is because we have established clear roles and clear delineation under the health standards to see that what must be housed by several as a level 6 hospital. You know, level 5 in provincial hospitals, now level 1, 2, 3, 4 primary health level. So PMG is supposed to serve level 6. Now funding allocated level 6. And suppose PMG is supposed to make him work, do look side long cardiac or heart services, kidney services, or cancer services, and money, and all work. But at the moment they're using this funding to look after everybody else, where some plant the old mamas have karim, and more normal deliveries, where suppose you straight more lower levels of health facilities, and mama will call it a slow lap. So I'd like to put on record that we like to come as long Australia government, all straight in Metoria clinic long, must be northeast, must be northwest. As I speak, for the first time, after many years, all mama now NCD, only now current baby outside long PMCH for the first time. Now only mama can go long Metoria clinic, or go make him also stop. We are now developing a improving the delivery or maternity section at K3.2 Hospital. Now, one kind of thing, kila. Ausik improving long habit staff. That's what we're doing at the moment. Lo review is the pressure of PMCH. At the moment, we must straight him to Central Province. We must straight quick killer. Maternity wouldn't open him long 3 months ago, 2 months ago. People are straight him now Agivaru, long Kariku district. We are now improving Kerema. All of these things. Suppose you know straight him by got impact long him, and affect him what is happening at PMCH. And me speak, Mr. Deputy Speaker, I'm explaining the planning time finish. And I want to say that we are doing all of these things at the lower level. Even also, we are not like we are not saying that we ignore the fact that this is happening. This is happening that we are dealing with some of these things. We're dealing with them. Deputy Speaker, I mean not to call some money go now waste now squandering more or you got dollar corruption lo health sector. I didn't say that last time was money go na corruption is stop na money no use good. Me to call some suppose you got some evidence of corruption. You got system in place to deal with those corruption. You mean we cannot ignore the corruption that's happening, but if there are some evidence of corruption, bring those reports to us. We deal with them accordingly. So the 2 million dollars money no go all provincial hospitals or PHAs. Our records funding is going. And there are some areas that funding is go, but even looking for some more service improved too. I've visited many of our districts, our PHAs, and I'm actually not really happy with the way that all you perform. That's why the record of funding will go along. So, Mr. Deputy Speaker, just some of these things I want to say again, put on record that we are congruent. We are fully aware of what's happening in our health system. I mean, thank you again, long all media. Keep exposing us. In this crisis, whatever you call it, it's not crisis. We are building a resilient health system and we are doing these things. Thank you, Mr. Speaker.